Well, we've got a quorum. You want to go ahead and get rolling? All right, let's do that. Madam Clerk, whenever you're ready for a roll call.
Mr. Chair, I'll use that for a second.
All right. Did I miss the roll call? Or Stacy, roll call when you're ready.
Okay.
Thank you.
Jeff. Curran.
Here.
Freely. Harrison.
Here.
Hinkleman. Pitchford.
Present.
Ott. Tyler.
Here.
Werfel.
Here.
Bullrath.
Here.
Yarborough. And Elliott.
Here. We have 10. Enough to do business. Minutes from last week need to be approved. Anyone want to make a motion to approve those? Moved by Hinkleman, supported by Freeling. Any discussion? Hearing none. All in favor signify by saying aye. Opposed, same sign. Minutes are approved. Requisition review.
Good morning. So I'm sure you guys read every single email I send you, but just in case you might have missed this one. So today is the day for the 6-month fuel bid. And so what that means is the bid's going to get opened. I'll get the results. I'll come to finance. Finance will send it back to the department and let them go ahead with the lowest bidder if they meet specifications and requirements. I will then go create the resolution with the contract with the supplier. Then I'll go see admin. Admin will see the resolution, and then that will be an added resolution on today's agenda. So besides the fuel bid part, does anybody have any questions about any of the other requisitions or change orders on the list? Thank you. So I won't have you sign this now. You'll sign it at 10:30. Thank you.
Okay, thank you. We have an update from the health department. Guy Miller is here. Guy, what do you have for us?
I'm doing a little bit of a presentation on a potential program that we could bring to Berrien County. This is something that's been discussed in the past. The state of Michigan has money set aside for Berrien County, but we'll have to bring forward an authorizing resolution to accept these funds to run this program. Thank you. Program is a harm reduction program. It's linkage to care, harm reduction, wraparound services. And today we're going to talk about some data as well supporting that program. So what is harm reduction? It's a little bit of a new terminology. I did discuss this with the Board of Health. I think there are some questions around why are you calling it harm reduction and not solely a syringe service program? So harm reduction is a practical and transformative approach that incorporates community-driven public health strategies, including prevention, risk reduction, and health promotion to empower people struggling with substance use disorders and their families with the choice to live a healthy, self-directed, and purpose-filled life. And that's from SAMHSA. That's a quote from SAMHSA on what the definition of harm reduction is. So this program obviously consists of referrals to substance use disorder treatment, overdose prevention, HIV and hepatitis C testing, hepatitis A and hepatitis B vaccines, medication take back, safe disposal of syringes, and free sterile syringes. That's why it's not solely identified as a syringe service program. We know that HIV diagnoses are down among people who use injectable drugs. More access to syringe service programs can help further reduce the HIV prevalence, especially here in Berrien County. So additional benefits to harm reduction. So some of the data has shown harm reduction started really back in the 1980s with syringe service programs, 1990s. It incorporated to more wraparound services, not solely dependent on the syringe service program. So new people who are into the syringe service program or the harm reduction program are 5 times more likely to enter drug treatment, and 3 times more likely to stop using drugs than those who do not enter a program. Syringe service programs have had a 50% reduction rate in HIV incidences in the community that they're enacted, and a 50% reduction rate in hepatitis C incidents. SSP increases, syringe service programs increase the likelihood of proper disposal of syringes and other hazardous material. And we see a 66% reduction in accidental needle sticks in law enforcement personnel. The additional wraparound services that this would provide as a harm reduction program is to distribute HIV and other information on communicable diseases, test participants for HIV and hepatitis C, educate on substance use disorder, their effects and their impacts, promote treatment and recovery resources, dispense fentanyl testing strips, one of the key overdose drugs that's been in Berrien County that has been killing Berrien County residents. They are fentanyl-laced drugs. And then dispense Narcan and provide wound care as well. So some of the data as to why this might be a good idea in Berrien County, our acute hepatitis C rate by county level and local health jurisdiction. This is kind of the same map twice, but you can see on the lower left in Southwest Michigan where we're located, we are one of the high incident counties for hepatitis C in the state of Michigan. Additionally, if you dive a little bit deeper in this data, you see
Guys,
that.
stand by one moment.
Yep.
Maybe you're getting ready to tell us, what is hepatitis C?
Hepatitis C is a viral infection of the liver that's often transmitted through blood-to-blood contact. So it could be through a blood transfusion, but typically you see transmission when people are sharing needles. So a closer look at what's going on in Berrien County highlights the areas of Niles and Benton Harbor as high incident areas for hepatitis C. These data serve as a great proxy indicator for the use of injection drug rates, kind of just as Commissioner Yarborough alluded to. That's my connection point right there is yes, if you're seeing higher incidence of hepatitis C in a community, it's likely that you have a high rate of injection drug use in those communities. There are some really helpful tools on the state of Michigan's website. This is called the Michigan Substance Use Vulnerability Index, and this is a way of indexing what is the risk in your community. So the Substance Use Vulnerability Index takes substance use burden, which we're ranked 35 in the state of Michigan for, substance use resources, which I think we actually have quite a few substance use resources in Berrien County. We're ranked 14th, and that's out of 83 counties in the state of Michigan. And then it takes the social vulnerability index, so things like what are people's access to healthcare, transportation, food. And those scores do highlight Berrien County as being 19th highest risk for substance use, for the substance use vulnerability index. So the good thing is we do have resources, but I think what we're lacking is the gap to connect people to those resources. We know quite a bit about our overdose data. I think you guys have been keeping a really good eye on what's been going on. A few months back, we had the medical examiner do a presentation on overdose deaths. Now, in 2025, we did see a pretty significant reduction in overdose deaths, and I think that's a great thing. I'm really excited for that. But in the previous years, we've had some of the highest incidence rates of Berrien County of overdose deaths. That does put us at one of the highest risk categories in the state of Michigan. Our provisional 3-year average of overdose death rates going from 2021 to 2023 is again shaded in the dark. I think we had close to 37 overdose deaths in Berrien County, which that rate calculation does put us at one of the highest categories in the state of Michigan. So on average, the state of Michigan saw 29.2 overdose deaths. In Berrien County saw 33.4. So we were higher than the state average. Just a little bit of history on the syringe service programs. There are 37 operating syringe service programs in the state of Michigan. And you can see on the map to the right there, there's kind of a significant gap, I think, in services for syringe service programs. We don't see a lot of the border counties having them. We do have syringe service programs across the border in some areas of Indiana, but our closest one really to us would be in Kalamazoo. And we've been working pretty closely with Kalamazoo to make sure that whatever we're bringing into Berrien County is going to be based off of best practices of what they've been operating for quite a few years now. So there are 141 operating sites across the state of Michigan, and again, 37 operating organizations. So an overview, harm reduction program will leverage staff that we already have in the field, skills already established within the Berrien County Health Department within our current workforce, expanding our outreach efforts and enhancing service delivery with the existing HIV outreach programs that we already have established. In partnership with Corewell Health, they've been a huge partner in this. The Berrien County Health Department, if we're able to accept these funds from MDHHS, would sufficiently establish 2 locations in Berrien County in the 2 areas highlighted in that map, the areas of the highest risk, the highest hepatitis C prevalence, the Niles community and the Benton Harbor community. In our partnership with Corewell, we would bring access to harm reduction services, referral to treatment, disease testing, Narcan, syringe service, as well as wound care. This can be a 2-year and is intended to be a 2-year pilot program. I don't think we're going to have a ton of traction in the first year based off a historic review of what happens with these programs when you bring them in. The population's a little bit apprehensive about accessing them. They're not sure if this is true, if this is a real resource. So it usually takes 1 year to start seeing people consistently showing up at these types of programs. So pending continued funding from MDHHS to reduce the spread of disease, assist persons in harm reduction, and connect people to recovery resources. And that's something I really want to stress is the overall intent is we have a gap in accessing resources. We do have resources available in Berrien County. However, we have a hard time getting the population that needs those resources to access those critical resources. So part of our partnership with Corewell is we're working directly with their substance use disorder and education team, which was newly established in 2024. They opened up a primary care clinic down in Niles. So we're working with that team to establish once a week we'll be down at their Niles location operating out of their facility. And once a week we'll be up at their Benton Harbor location in their facility right next to substance use disorder providers to give people an easy or warm handoff, as we call it, into recovery. I have plenty of information on any legal matters that people might ask. If we have questions that our corporate counsel would like to review in terms of the legal matters, I've got a lot of information on that. These programs being around since the 1980s, there is a lot of different references available. There's a lot of white papers or articles that have been written about syringe service programs and how they benefit a community. And I'd be happy to discuss any of those questions that you guys might have.
Questions, sir?
Could you just give us an idea empirically, like after this program is ended, what type of numbers do you want to see to be able to look back and say it was successful?
So we'll have, excuse me, we'll have a lot of key performance indicators to make sure that people are accessing programs. The question is, I think the first question is how many people are struggling with the substance use disorder in Berrien County? We don't really know those numbers. We know how many people are accessing treatment. We can pull information like that. But what the data was trying to paint a picture of today is that we do have a high burden of acute hepatitis C. So that means an acute versus a chronic illness. Acute is you are actively having hepatitis C symptoms. You have elevated liver enzymes. You might have the jaundicing of the skin or yellowing of the eyes. That's an acute phase. We do have chronic hepatitis C as well, which exists in our community. There's been a big push in the medical community to test more people. And that is kind of alluding to that question of, well, how many people actually have hepatitis C? We don't know until they're testing. How many people are struggling with the substance use disorder? We don't know until they enter services. I think that's a challenging question. So what we want to see are key performance indicators on the number of people getting serviced, the number of people doing testing, and the number of people that are falling into care for HIV. That's something our HIV programs closely monitor. we have a relative number of people who have tested positive for HIV. The hard thing is connecting with them after they've tested positive for HIV. So we do know of people who are out in our community that might have a virus that is treatable. At least we can reduce the total viral burden to get people so that they no longer transmit the virus. So that is the goal of these HIV programs, is to get people into care. Hepatitis C, it's treatable now. That's been a drug, I think it's been out for about 8 years now. To treat hepatitis C, which had previously been incurable. So obviously getting people cured for hepatitis C and getting people into care for HIV is our communicable disease approach.
You mentioned Kalamazoo has had this program. What have the reductions been in Kalamazoo for the HIV and the?
Yeah, so
hepatitis.
like I said, they've seen 50% reductions in things like HIV and a 50% reduction. That was in the beginning of our slides. I don't have that. I don't know how long Kalamazoo's been doing that. So I can find that though.
Other questions? Ma'am?
Guy, thank you for the information. I know we're looking at a 2-year pilot program for this through NDHHS. What is our fiscal contribution to that? What does that look like from the county's perspective? And what is our sustainability? If we're looking at a 2-year, what are your plans within your department to help to sustain this with the partnership with Corewell?
Yeah. So going to the books, Commissioner, I like that. So it's $91,000. It's called a match program, as Commissioner Warfel pointed out. It is match dollars from the state, and it is opioid settlement dollars from the state of Michigan. So in terms of Berrien County's investment, $0. We're leveraging. I'm not creating new complements on this, although a lot of places have created new complements. I think it's sustainable as long as the opioid settlement dollars are there from the state of Michigan. I think that's something I need to clarify, is we're not using Berrien County appropriations or Berrien County opioid settlement funds. The opioid settlement funds kind of got split in half. Half of them went to local municipalities, half of them went to the state. That is the state's bucket of opioid settlement dollars. They said harm reduction programs across the state of Michigan is what we want to fund. They actually approached us and said, hey, Berrien County's got a lot of high risk factors. There's not a lot of harm reduction programs down in Southwest Michigan. We'd love to see you guys do one of these. Would you be willing? So again, my proposal today is actually authorizing resolution that'll come next week for the harm reduction program in Berrien County.
Other questions? Sure.
If there are no other questions, not to take out of turn, other counties that are in the surrounding area, have you been talking to Cass, Van Buren, and the others of making them aware that this is something you're proposing?
I haven't. I have not, but I'd be more than willing to connect with Cass and Van Buren County. Being down in our Niles location, that's pretty close to other jurisdictions, so I wouldn't at all restrict people from accessing if they're coming from Van Buren or Cass County. As we're partnering with Corewell, they have noticed that a lot of people are saying, why don't we have these programs here? A lot of their clients who would be seeking harm reduction services are saying, why don't we have these types of services here?
So is the Board of Health going to endorse this and send it to Personnel and Human Services for adoption? Is that the plan?
Yes, that'll go today to
Okay.
PHSD.
And then corporate counsel will be looped in to review as per our procedure. Okay. All right. Thank you for coming.
Thank you.
So what else do we have here? It says public comments. We're moving right along. Anyone have anything they'd like to share with us in 2 minutes or less? If so, name and town if you wish to opine. Yes, no,
Mr. Chairman,
sir.
I was just going to point out that Dr. Byer is here on behalf of the Health Department. Should the board have any questions about what Guy's just presented on or anything else related to matters of public health, he is here in case you have questions. Thank you, sir.
Are you doing general consults, Dr. Byer, or just?
My ER hours will be posted if you like.
Okay. Okay.
Well,
Well, it's good to see you as well, and we're happy to hear from you if you have anything you'd like to share.
put on the spot there. I just want to reemphasize what Mr. Miller said, that the key to this is to help get patients or people into care, and that the wraparound services is really a significant portion of this. Once you get people who sometimes don't have trust in the healthcare system, understanding that we're there to help them and then we have a variety of things to offer them, it increases the chances that they will allow us to do more services, things like how do we help you get off of drugs, which is a hard sell when someone comes in. If you just present them with, hi, I'm glad you're here, I need you to stop doing drugs. While obviously that comes from a good place, sometimes patients aren't ready for that. But if they know, hey, I can come here, they'll be non-judgmental, they'll help me with wound care, they'll help me with a few other things, I can pick up some Narcan. When they're ready, knowing that they have someone who is empathic and will listen, that's the time you can be like, hey, I know you're here again. And they'll be like, hey, I'm really willing to listen. I really want to hear about getting off of these drugs. Cool. I have someone in the table next to me who's going to help you with that. And that's really the key to these services, is helping them make that progression to getting off of drugs.
I don't know if there's any data, but just common sense guess is that for every person who comes in voluntarily and seeks treatment, there are multiple people who have not yet reached that threshold where they've decided, I've got to do something about this. So the more outreach, the better. Anyone have anything else? All right, we'll close public comments then, and there's an announcement on here that we're not meeting on the 27th, of course, for Thanksgiving. Does anyone have any? I know you wanted to, I know. But next year maybe. One thing that someone suggested to me last night, and I don't know if this is a good time to mention it, we got a few minutes. A couple of years ago, we had a holiday gathering at River St. Joe, and they stuck us out in what was basically like a greenhouse. No, I'm not. I mean, indoors is one thing, but al fresco, no. Anyway, somebody suggested that new place, McCulloch, I think, the Grant Hotel, and the McCulloch Restaurant along McCoy Creek. Oh yeah, you were there, Jim was there. Amy got there just in time to be in the photo. Perfect timing. She came, Jim grabbed her, Amy, pulled her in. But someone suggested that, so just give it some thought if you'd like to try it out. I've only been there one time. It was chaotic because they had just opened, so hopefully the chaos has been put in the rearview mirror.
I don't know what the menu is.
Yeah.
We had some sandwich, something.
I don't know, I had like a Mandarin chicken salad, which was pretty good. But anyway, just something to think about.
I'd like to do something. We went to Navajo last year.
Yeah.
That was nice.
Oh, gosh, that was
I've
really
been there in a month.
Yeah. Anybody have anything before we break?
Mr. Chair.
Ma'am.
I had wondered if our administrator might be able to just give us a brief update of where we stand on the budget. I know next week we'll be, having public hearing. I do know that staff's been working very hard. It's not ready, but
Very close. Mr. Chair, is it all right if I respond to that question?
Sure.
Okay, so Jake just stepped out to make photocopies. Our plan for today was to go direct to the Finance Committee to brief you all on what we have been doing to try and get this ready for your final review on the 20th. So instead of doing that, going to Finance and then hitting the other two committees, we've got a few minutes. We'll talk with you all now. So once he steps back in, there is a one-pager that we'll walk you through. But put simply, we have been prepping for the meeting on the 20th. At your last workshop, the board, we had 9 in the room. 9 indicated that your preference is to see this absolutely balanced and with a minimal, if zero, drawdown of fund balance. So to achieve that, we would have to defund a variety of positions. Thank you, Jake, if you'd be willing to hand those out. We would have to defund a variety of positions at the court, and we would have to eliminate some of the planned positions at the juvenile center. Yesterday, we got a response back from the court saying that they were concerned about that plan. They had requested that the positions be funded at a 50% rate. So back and forth between myself and the court administrator, what I've made clear is that the board has stated both through committee as well as at the budget meetings that the court wants to see, or I'm sorry, that the board wants to see a plan from the court on how they will fill the bulk of the vacant beds at the juvenile center. And what I've said in writing to the court is that my recommendation would be to fund at 50% their vacant positions, contingent upon that plan being presented by the court to the board, and the board having an opportunity to review and then ultimately accept their plan. Meaning, if you all are not happy with what the court is proposing to fill the beds at the juvenile center, then the funding for those 50% would be eliminated. Yes, sir.
Just to underscore, clarify, still gonna come back, we're gonna be looking to finance for a recommendation on that,
Yes, sir.
and it's ultimately going to be our call.
Sir, it is absolutely the board's prerogative. We have made clear to all departments that the board's target is for a balanced budget with a minimal drawdown of fund balance.
Okay.
So what you've got,
Stand by, ma'am. Julie.
With the court wanting the 50% to be funded, what were they willing to give up? What did they adjust? Since all the other departments made adjustments, what were they willing to do?
so we will hand out a memo from the courts. It's a multi-page memo that goes through and tries to summarize the various cuts that they have offered up, surrendered, however you want to put it. So I have that document. I'll get that into committee's hands. Mr. Chair, if I could just reference the one pager. So this was going to finance today. So what you will see is that if we proceed with the 50% funding request from the court, original drawdown of fund balance had been planned for roughly 1.2 million. We've managed to close that gap down to a use of fund balance of 120,000. So while not at zero, it is a dramatic reduction in what we were looking at just 3 weeks ago. And it also allows for you to have a very healthy fund balance, right now targeting 37.2%. Mr. Chair, we've got some hands going up.
Sir.
That's a dramatic reduction, so great job on that. Getting it from this number to zero, how hard is that going to be for you?
So I think that you've had really good cooperation from a variety of departments, from a variety of elected officials. This is absolutely going to be pushing existing staff to keep up with the workflow, to keep up with the public's demands. It is absolutely going to be a lean budget. It is one that we are absolutely trying to just stick to the facts. We had a significant reduction in overall revenue, and we're trying to balance. The way that this has been presented to department heads and elected officials is we only have so many tools. And our ability to work through this is we are running with the assumption of no increase in revenue. And the only way to get there is through the selective cutting of various expenses. We have very intentionally not targeted the elimination of existing positions.
Right.
There is no layoffs planned through this budget proposal.
Anyone else have any questions, comments? I have one, just to, I guess, underscore. It's sort of like when you're cleaning out your garage, if there's stuff in there you haven't used for 3 or 4 years, you probably don't need it. Or you don't need it there nearby. Positions that have gone unfilled for 3 or 4 years. It's not a perfect analogy by any stretch, but do we need those positions if they haven't been filled in 3 or 4 years? Can we eliminate them? Should we eliminate them? And then if something comes up later, that department comes back or that elected official comes back and says, circumstances have changed, we would like to add or reinstate that position. Okay, fine, but to fund a dormant position, especially in light of the meeting yesterday with Blue Cross Blue Shield, we're meeting with them again next week. Going to be talking about options that heretofore we didn't know we had and wouldn't have known about had we not met with them. And if you can save X dollars and X is what it takes to maintain prescription coverage for certain items. And X is also the cost of funding dormant positions. It begs the question, why not? So my 2 cents worth.
Mr. Chair, so the chief judge and court administrator are reporting today to the admin committee.
Yep.
I will take the court's memo. I will walk this to all of your committees. Should the board wish to continue pushing for that plan, today would be a perfect time to have that conversation with the court leadership.
Mr. Admin Chair, you want to do that? Okay, thank you. All right. Anyone have anything else? Well, and we have an extended break for restrooms and things like that, and we'll start the committees at 1:15.